Thanks to invited me in this very important panel regarding the COVID-19 pandemic, uh, which is a really big challenge regarding to the 21st century. Uh, in one hand, there is a technological advancement. On the other hand, the whole world is devastating. And what I have, the panel have, shared their experience, and it is a really alarming wake-up call for whole world, and particularly for the working class who should understand the scientific, you know, uh, strategy to lead this mass struggle and to, pressurize everywhere and and develop and implement the, eradication strategy globally. So regarding to South Asia, as you all well know, that it is home to quarter of the world population and has been devastated by the pandemic with a total death uh, from the COVID-19 is more than 5 million. Official figures regarding to India, it is 50,000, while Pakistan around 28,312. But in my point of view and in my practice as a doctor, and very nearly I have keep in touch with the medical institutions and all these statistics and data of the government, it is completely underestimated and false. There is millions or more deaths in the subcontinent which is not reported. And it is the open fraud of the government wants to cover up their utter failure to protect the population. And according to their own statement, which they have repeated, both country in Pakistan as well as Modi in India, that keep the economy open. Their first priority was regarding, even they know the danger of the pandemic, but their priority was to open the economy. At the height of pandemic, on the second wave, which healthcare system was overloaded and lack of, the medicine, other equipments, PP, personal protective equipments, oxygens, beds, and etc. Modi went on national television to woo that he would save the country from lockdown, not from the virus. So one can see their priority and their indifferences to the masses. The other aggravating factor, in the South Asia, there is a terrible state of public health care system from decades, and particularly after the, the open market economy. In the public sector, there was no investment has been done by the state, and the system is, in a state of decay, progressively and fastly decaying, particularly in the whole subcontinent in the countryside. And as well, the majority of the population which are living in the countryside, And regarding in the context of Pakistan, you know, and after the occupation of the Afghanistan, 20 year, the war, the drone strike, and the military operation have displaced millions of people across the country, and you know, and the dislocation of the problems and the basic infrastructure and you know, basic needs like water, sanitation problems, and in the cities, the swelling of the, you know, huge area has been gradually uh, covered by the slums. And it is with this situation, fight with the pandemic is a great challenge.